61 question. The component of partograph are all except A. Time. This is true. Fetal heart rate is also there, and maternal urine analysis is also there, but there is no maternal respiratory rate. So answer here will be C. Which of the following information are provided by the partograph? So from partograph we can know about the color of the liquor, uterine contraction with the duration and frequency, and dilation of cervix. So all of them are correct. So answer here will be D. 1, 2, 3 are correct. Intraoperative recognition of the ureter is by which of the following feature? So transparent tubular appearance, no. Ureter do not have transparent tubular appearance. Pale glistening appearance, this is true. Longitudinal vessels on the surface, this is also true. Circumferential vessel, no. There are longitudinal vessels, not circumferential. So this is not true. So answer here will be 2 and 3. So option C is correct. Hysterosalpingography is least helpful in detecting which of the following? So tubal patency, yes. Hysterosalpingography is mainly used for tubal patency. It can also tell about the Asherman syndrome and congenital uterine anomalies such as uterine diadelphys, septate uterus, uniconvate, biconvate, etc. But it do not tell about the pelvic adhesions. It can tell about the uterine adhesions such as Asherman syndrome, but not about the pelvic adhesions. So answer here will be B. Which of the following are the characteristics of the trichomonas vaginitis? Presence of greenish frothy discharge, yes, this is true. Vaginal pH greater than 4.5, yes, this is also true. Presence of clue cells, no, this is not true. Clue cell is present in the bacterial vaginosis, not trichomonas vaginitis. So this is not true. And strawberry spots, yes, this is also true. So answer here will be 1, 2 and 4. Option B is correct. Tumor markers of the epithelial cell tumor. This is a direct question. It is CA 125. The most common site of the cervical cancer is A. Endocervix, no. B. Ectocervix, no. Transformation zone is the most common site for the cervical cancer. So answer here will be C. The placenta synthesize are all except estriol, this is true. Corticotrophin releasing hormone, this is also true. PAPPA, this is also true. Dehydroepiandrosterone, no, this is not true. DHEA, it is secreted by the adrenal glands, not by the placenta. Withdrawal bleeding following the administration of progesterone in the case of the secondary amenorrhea indicates all except absence of pregnancy, this is true, because in the presence of pregnancy there will be no withdrawal bleeding. Production endogenous estrogen, this is also true. Endometrial is responsive to estrogen, this is also true. Defect in the pituitary gland, no, this is not true, because progesterone is not secreted by the pituitary gland, so it do not have any direct relationship with the pituitary gland defect. Monilial vaginitis is commonly associated with all except. Monilial vaginitis is also known as the candida vaginitis. So prolonged antibiotic therapy, yes, this is true. Diabetic mellitus, yes, this is also true. Treatment of malaria with chloroquine, no, this is not true. Candida vaginitis is not related to the treatment of malaria. And in pregnancy, this is also true. So generally candida infection occur in the immunosuppressed states. So here answer will be C. Which of the following is not a risk factor for the development of placenta previa? A. Maternal age, yes, this is the risk factor. Smoking is also a risk factor, and previous cesarean sections are also a risk factor. But maternal anemia is not a risk factor for the development of placenta previa. Placenta previa is the type of antepartum hemorrhage which occur due to the low-lying placenta covering the os, the internal os. So answer here will be D. common clinical presentation of moderate to severe absorption are all except. So in the abruptio placentae, uterine tenderness is present. This is true. Fetal distress is also there, and unexplained preterm labor is also there, but prolonged labor is not there. So generally, preterm labor is there, but not the prolonged. So answer here will be D. Common trisomies resulting in the spontaneous abortions are all except. So trisomies which results in the spontaneous abortions are trisomy 5, 13, 16, 18, 21 and 22. So answer here will be D. Trisomy 1. This is not related to the spontaneous abortions. The initial prevention strategy for APLA syndrome, antiphospholipid syndrome, is steroids, no. Heparin, this is true. Low dose aspirin, this is also true. And progesterone support, no, this is not true. So answer here will be 2 and 3 option number A. Diagnostic criteria for PCOD are oligo upon amenorrhea, this is true. Hyperandrogenism, this is also true. Polycystic ovaries on ultrasound, this is also true. So answer here will be, all options are correct, so option D is answer. Which of the following can be associated with the pelvic organ prolapse? So in the pelvic organ prolapse, there will be a difficulty in passing urine, this is true. Incomplete evacuation of urine, this is also true. Urgency and frequency will be there. So all the options are true. So answer here will be option D, 1, 2, 3. A 30-year-old lady, P2L2, present with the painful unilateral swelling in the vulva for 3 days. Which of the following statements are true regarding the above case? Bartholin sepsis may be a likely diagnosis, this is true. It is to be managed by marsupialization, no, this is not true. Bartholin cyst is generally managed by the incision and drainage. Gonococcus is the most common pathogenic organism, this is also true. So answer here will be option A. 1 and 3 are correct. Which of the following is not a sign for the separation of placenta? Uterus become globular, firm and bilateral, this is true. Fundus height reduce further, no, this is not true. After the separation of placenta, the fundal height will increase for some time. Slight bulging in the suprapubic region, this is true. Apparent lengthening of the cord with the slight gush of vaginal bleeding, this is also true. So answer here will be B. Consider the following regarding the examination of a rape victim. Emergency pill is provided, this is true, to prevent any pregnancy. Internal examination must be performed, no, this is not true, because this generally require the consent of patient or guardian. So it is normally not done in all the cases, so this is not true. HIV testing is done, this is true. So answer here will be option A, 1 and 3 only. Which of the following cardinal movements of the mechanism of labor? What is the correct sequence? So the sequence is ED Pfizer. So engagement is there, descent, flexion, internal rotation, then crowning, external rotation, restitution, etc. So here after arranging them in a sequence, the option B will be the correct answer. 1, 3, 2, 5, 4, 6. Which of the following represent the properties of ideal disinfectant? It should be broad spectrum, this is true. It should be fast acting and it should be non-toxic. So all the 3 options are correct. So answer here will be 1, 2, 3. Which of the following can help reduce the risk of systemic hypertension? Reduction in dietary intake of common salt, yes, this is true. Controlling weight for age, this is also true. Increasing potassium rich, this is also true. So we have to decrease sodium and increase the potassium. So answer here is D, 1, 2, 3. Keeping biological determinants in perspective, consider the following statement. Presence of normal steroid is the first requisite for human health, this is true. Genetic screening can play an important role in the prevention of wide spectrum of the disease, yes, this is also true. If an individual is allowed to live in the healthy relationship with the environment, the Person's genetic potentialities can transfer into phenotypic reality. Yes, this is also true. So here all three options are correct. Answer will be C. Niti Aayog has the following roles except it provides critical direction and strategic input in the development process. Yes, this is true. It provides relevant technical advice with focus on technological upgradation. Yes, this is also true. It focuses on the capacity building. This is also true. It focuses on the development of referral services. No, this is not true. It do not focus on the development of referral service complex. Poor hygiene of the mess worker in the university college mess led to hepatitis A cases in the hostel. What type of epidemic is this? So it is a common source continuous epidemic because the source is common, which is the mess worker, and it is a continuous exposure because the students eat food daily from same mess. So continuous exposure is there. So answer will be 2. Option D is correct. What is the specificity of the sputum microscopy in detecting the pulmonary tuberculosis? So here specificity is as, so specificity will be 180 upon 200. So 180 upon 200 specificity, so it will be 90%. Answer here will be 90%. In cohort of 500 women attending the antenatal clinic, 70% had the ultrasonography. This cohort has followed up at delivery. Of the women who had USG, 70 delivered low birth weight babies, whereas of the women who did not undergo USG, 50 delivered low birth weight babies. The incidence of babies among who had USG is, so after calculating the answer will be 20%. So incidence is calculated by 350 upon so 350 has undergone USG, and out of 350 we know that 70% has the low birth weight. So by dividing 70 upon 350 we can directly get 20%. Major source of vitamin K1 is fresh dark green leafy vegetables. This is direct question. Phytoquinone will be there. Which of the following is not a function of epidemiology? To study historically the rise and fall in disease in the population. This is true. Searching for the cause and risk factor. This is also true. Identifying syndromes. This is also true. Making clinical diagnosis. No, this is not true. This is not the feature of the epidemiology. Which of the following is not a contagious disease? So we know that scabies, trachoma, leprosy can spread, but malaria need vector for the spread, so it is not a contagious disease. Answer here will be malaria.